Colorado Governor Polis warns devastating cuts and economic disaster could be on the horizon for the state if Congress cuts Medicaid.
The governor outlined his concerns in a letter to Colorado's congressional delegation Monday. Denver 7's Brandon Richards shows what Polis said and how one member of Congress is pushing back on his claims.
In recent weeks, we've heard from Colorado Medicaid patients like Jean Cisneros, urging lawmakers not to cut the program.
So please don't do this. Keep us funded.
Monday, Colorado Governor Polis and Lieutenant Governor Diane Primavera sent this letter to Colorado's congressional delegation, sharing why they believe cuts to Medicaid would have devastating consequences.
And we wanted to just make sure that they understood where we were at. Our fear is that hundreds of thousands of Coloradans would stand to lose their health care coverage if the Republicans in Congress make the cuts that are proposed.
They say Colorado could lose as many as 12,000 jobs, $1.3 billion in economic productivity, and $82 million in state and local tax dollars.
This isn't anything we want for the people of Colorado.
The Republican budget plan directs a committee that oversees Medicaid to identify $880 billion in savings to help pay for President Trump's agenda.
This bill is
Colorado Congressman Gabe Evans is a member of that committee.
And this bill does not set any specific policies directing cuts to any specific program, to include Medicaid.
Evans says he doesn't support cuts that harm Colorado providers or patients, and instead supports removing waste and fraud. In fact, many Republicans say that's all they want to do. But Adam Fox with the Colorado Consumer Health Initiative is highly skeptical.
The reality is there's nowhere near the level of waste, fraud, and abuse that gets them to $880 billion in cuts. It is not possible. There's no way to get to that number without terminating coverage for millions of Americans.
Now, what ultimately matters is what the bill says once it's written. That hasn't happened yet. The committee tasked with finding all of those cuts could begin its work early next month, and of course, we'll be watching. Reporting in Denver, Brandon Richard, Denver 7.
And going in depth here, we've seen the impact that Medicaid funding can have, cutting funding can have here in Colorado. More than 500,000 Coloradans were removed from Medicaid coverage at the end of the pandemic. When American Rescue Act funds ran out, eligibility standards were then reevaluated, and the majority of those who lost their coverage exceeded the new income limit. Well, Colorado mental health centers, which rely on Medicaid reimbursement to serve those who are uninsured or underinsured, have told Denver 7 they had to make major cuts. Jefferson Center, a mental health facility, laid off 25 workers at the end of last year.
At a time when behavioral health is needed more than ever before, it's really devastating to see the impact across Colorado.
Jefferson Center says it now has more than 6,000 clients without insurance.
And looking closer, Health and Human Services Secretary Robert F. Kennedy Jr. is reversing course on Medicaid coverage for medications to treat obesity. This comes after the Trump administration announced it would roll back a Biden-era plan to expand Medicare and Medicaid coverage for popular weight loss medications like Ozempic and Wegovy, when used exclusively to treat obesity. Right now, these GLP-1 drugs are only covered for patients who are obese or overweight and have heart disease. But Kennedy now says he's open to a new framework that would allow coverage if patients first try other options like diet changes, exercise, or glucose monitors.
Tonight, Harvard University is the latest